Good morning from the Hawaiian Eye Conference on the Big Island of Hawaii. We're pleased to be here today with Dr. Eric Donnenfeld, who is our ASCRS iWorld Medical Editor. Thanks a lot, Eric, for being with us today.
Always a pleasure. Thank you.
Eric, I understand that you have some updates for us regarding the Tecnis Symfony lens, which has been a great extended depth of focus IOL platform to help presbyopia correction at the time of cataract surgery. What are some of these new data that you have to share?
Well, first of all, the Symfony lens is a disruptive technology that really changes the way we think about presbyopic IOLs. And that, as an extended depth of focus, it doesn't have two focal points. It has a range. And what we've shown is that because of this range, you have a lot more forgiving lens, that you can be off a little bit on your landing strip. You can be a little hyperopic, myopic, or have a little residual astigmatism and still achieve excellent quality of vision. You don't have to hit your refractive target exactly, although we always prefer to have an exact target where you'll get the best vision. But what the Symfony brings to the table is it brings the highest negative spherical aberration, and for the first time we have a fully diffractive lens, both at near and far. It's the only lens in existence that does this, and by doing this it also reduces chromatic aberration. So the minimal quality of vision that's lost because of the extended depth of focus is gained back by reducing chromatic and spherical aberration. So quality of vision is excellent, patient acceptance is excellent, and my mantra for presbyopic IOLs is that when patients want a presbyopic IOLs, they want to be able to read, but they demand to be able to see far away, distance. This lens meets all these criteria.
I wonder, Eric, if you can speak on the nature of the Symfony lens in terms of its effectiveness in a unilateral versus bilateral implantation. Do you think that it's important for patients to have that lens match in both eyes to sort of maximize its potential?
Well, we're seeing that you can actually personalize the vision to the patient's demands, and that patients who want the best distance in some reading will get a Symfony in both eyes, but we're very successful now in implanting the Symfony in the dominant eye. In the non-dominant eye, we can go up to a ZLB, which is a 3.25 add multifocal from Tecnis, and that gives you the additional reading at near. So the dominant eye is getting great distance and intermediate vision, and the non-dominant eye is getting exceptional reading. This personalized vision approach has served us extremely well, and our refractive target in both these cases is really close to plano, where we get the maximum visual acuity.
That's such a great point, Eric. And I wonder if, in closing, we can talk a little bit about some pearls, some surgical pearls about centering the EDOF rings at the time of surgery. What are some tips that you found to be successful in making sure that that lens stays centered?
Well, centering the lens is important. For the lens to function optimally, it should be in the visual axis. Doing a capsulotomy that's 5.5 millimeters or smaller, centering the capsulotomy on the visual axis, and we're using Zepto now, as well as femtosecond laser surgery to achieve optimal centration of the capsulotomy. And then we look at have the patient look at the lights on the microscope, and then we implant the lens centering on the first Purkinje image. By doing this, we optimize the quality of vision and the centration of the IOL.
Well, Eric, this has been such a great update for us on the benefits of the Symfony extended depth of focus lens. Thank you so much for sharing your expertise today.
Pleasure being here. Thank you.